I'm Dr. John Puskas. I'm chairman of the Department of Cardiovascular Surgery here at Mount Sinai Morningside. This is Mr. Edward Bettinelli, one of our patients, and he has a very interesting story to tell. Mr. Bettinelli, you had COVID. When did you get COVID?
I got it probably the first week of March.
And what symptoms did you have in March?
It was a Sunday. I noticed like just a typical cold, like I had a little scratchy throat, little runny nose. Monday morning I woke up, had a fever, low fever, but definitely all the symptoms of achiness and joint pain.
And it was back in February when you had had a stent placed in one of your coronary arteries by Dr. Sweeney.
Right.
Here at Mount Sinai.
Right.
And he and I discussed at that time the management of the other blockage in your heart, which was that most important artery in the front wall of the heart that was completely blocked. We schedule an operation, a minimally invasive, special robotic bypass operation. It gets postponed because of COVID. We keep our fingers crossed that you won't get COVID in the meanwhile. You did get COVID in the meanwhile, and you survived it. And after one positive swab, then 2 negative swabs, and an antibody test that was positive, we brought you to the operating room just 3 days ago for a minimally invasive robotic bypass operation. You were our very first patient here at Mount Sinai who had cardiac surgery after having had COVID. And in fact, you had robotic minimally invasive cardiac surgery. I suspect you may be the very first person in the world to have survived COVID and then had a robotic coronary bypass operation.
Yeah,
which is quite remarkable.
It is remarkable, and I'm quite lucky. I was in good hands.
That's kind. Not everyone has survived COVID. You have some personal experience with that.
Actually, my dad passed away the 26th.
So your dad died of COVID in April.
Yeah, so.
And you recovered from COVID in March.
Yeah.
And here we are now in June. You're 3 days after a robotic bypass operation, about to go home today.
Yeah. Yeah.
That's quite an experience.
Yeah. Life is truly a gift.
Life is a gift.
And one should never take it for granted, that's for sure.
So you are a musician.
I am a musician. I've been a musician my whole life. And I believe it or not, I brought my practice bag because I don't go anywhere without it when I'm going to be away more than 24 hours. And after having a bypass, I didn't know if I was going to be able to move those fingers and wrists and arms.
How are they working?
So they slow, but they'll be fine. A couple days it'll take to tweak. But I do have my thumb thing on, and life is good. I'm walking into a whole nother stage of my life, and I'm happy I was again here at Mount Sinai. Believe it or not, 4 days after open heart surgery, had a bypass. Crazy, but feels good to hit a drum. Take your health seriously. It's truly a gift. So be kind to you first, and then to the rest of the world.